Oregon was the first state to legalize psilocybin mushrooms for therapeutic use with Measure 109 back in November 2020. However, it will take at least 2 years before psilocybin mushrooms will be available for therapy. This is due to establishing a framework on how psilocybin mushrooms will be used therapeutically. Hallucinogens like psilocybin mushrooms have a bad reputation, and most people worry of the idea of using a Schedule 1 drug therapeutically. When someone thinks about hallucinogens, they typically think of bad trips in the 1960s counterculture. However, hallucinogens have been shown to have a low potential for abuse and have therapeutic effects in treating conditions such as depression and anxiety. Higher dosages of 20 to 30 milligrams or 3 to 4 grams of mushrooms have shown a significant decrease in depression compared to those taking smaller dosages of 1 to 3 milligrams. Individuals will experience various psilocybin effects at these dosages for about 4 to 6 hours. How does psilocybin mushrooms affect the brain? To start off, in our brain we have neurons that communicate with each other by electrical impulses and chemical signals. Those impulses and signals produce our experiences and behaviors by either encouraging or preventing another neuron from becoming active. These chemicals are known as neurotransmitters. Neurotransmitters that are implicated to have a role in depression are dopamine, norepinephrine, and serotonin. Dopamine is associated with a reward pathway and motivates us to complete tasks. Norepinephrine plays a role in our fight or flight response and gives us that adrenaline feeling. Serotonin is known as the feel-good chemical and helps regulate mood. Low levels of these neurotransmitters have been suggested to contribute to depression. SSRIs, or selective serotonin reuptake inhibitors, have been used for treatment of depression by increasing serotonin levels in the brain. However, serotonin is not the only neurotransmitter contributing to depression. Since SSRIs only address serotonin and none of the other neurotransmitters that contribute to depression, it comes to no surprise that 1/3 of adults with depression do not recover fully on SSRIs alone. SSRIs also take several weeks before a reduction in depressive symptoms is observed. Psilocybin mushrooms, when ingested, create psilocin. Psilocin is the active drug of psilocybin. Psilocin prevents the reuptake of serotonin and increases serotonin as an SSRI would. Unlike SSRIs, psilocin has a similar chemical structure to serotonin, allowing psilocin to bind to and stimulate serotonin receptors in the brain versus SSRIs inhibiting serotonin receptors. Functional magnetic resonance imaging, fMRI, has been used to map the brain activity of those with treatment-resistant depression under the effects of psilocin. In this study, imaging findings were compared against 19 patients' depressive symptoms that were assessed using a self-reported questionnaire. It was found that psilocin produced rapid and sustained antidepressant effects. And just 1 day after treatment, the mean depression score was half from the treatment score the day before. By 5 weeks of post-treatment, all of the patients except one saw a decrease in depressive symptoms. Psilocybin mushrooms have been shown to treat depressive symptoms in those with treatment-resistant depression, but still remains a Schedule 1 drug. Unlike antidepressants, psilocybin mushrooms provide immediate relief and reduction in depressive symptoms with no side effects and longer remissions of depression symptoms.